Today, EAACI stands as the leading world society in the field of allergy and clinical immunology. A scientific home to more than 20,000 members and representing the interests of more than 3 million patients across the world. From its headquarters in Zurich, Switzerland, EAACI represents an immense network of clinicians, researchers, allied health professionals, junior members, and patient advocates. What we see today, a vibrant global scientific community, is the result of a 70-year journey shaped by resilience, collaboration, and visionary leadership. But it all began with a simple yet extraordinary idea: that science could unite a divided Europe. The story of EAACI begins in a Europe profoundly divided by war. Only 5 years after the end of the Second World War, in 1950, European allergologists courageously gathered in Paris for the first European Congress of Allergy. In a moment when nations were still healing, scientists chose collaboration over division, science over conflict. This Congress marked the beginning of a scientific movement that would change the history of allergy in Europe.
At the beginning of the post-industrial age, allergic diseases could no longer be considered a rare disease of the aristocrats, as in the original description of Charles Blackley, but represented a rising epidemic, calling the attention of scientists and doctors all over Europe. These scientists and doctors in 1950 convened in Paris for the first European Congress of Allergy. The Paris Congress represents a pioneer example of how science can unify Europe. Only 5 years later, the end of a war that have seen European countries against each other.
6 years after that historic meeting in Paris, European allergologists reconvened, this time in Florence. Here, during the Third European Congress of Allergy in 1956, the European Academy of Allergy was officially founded. A scientific society was born, and with it, a pioneering vision for unifying Europe long before political treaties would follow.
However, for the birth of the European Academy of Allergy, we have to wait the Third European Congress of Allergy. That was held in Florence in 1956 under the chairmanship of Professor Umberto Serafini, the first EAACI president. All allergists convened in the White Hall of Palazzo Pitti unanimously passed the resolution of creating the European Academy of Allergy. Registered in Utrecht in 1957 and then officially recognized by a royal decree of Queen Juliana of the Netherlands.
EAACI was not only a scientific organization, it was a symbol of a new Europe. As political unions evolved, EAACI grew alongside them. 1957, European Economic Community founded. 1993, Maastricht Treaty. 1995, Austria, Finland, Sweden joined the EU. 1999, the euro is introduced. 2013, Croatia becomes the 28th member state. While borders shifted and alliances transformed, EAACI stood firm as a place where science transcended politics. By the early 1970s, scientific understanding had expanded. Allergy could no longer be seen as isolated from the broader immune system. In 1971, EAACI officially changed its name to the European Academy of Allergy and Clinical Immunology, reflecting a new era of integrated scientific thinking.
The description of the 4 immune reactions by Gell and Coombs in the 1960s dictates the way for our discipline not to restrict to diseases due to type 1 allergic reactions, but to become a more transversal specialty, also dealing with autoimmune diseases, immune deficiencies, immunology of transplantation, and cancer. However, we should not forget the area of interest of our discipline in guiding political decisions, while trying to adapt it to emerging needs in healthcare, such as environmental health, global health, and fight against emerging pandemics. Our academy is continuously working on improving nomenclature and including new developments in our education and scientific programs.
By 1986, the Academy's infrastructure was still largely manual. Membership records consisted of 700 handwritten cards, marked with a pencil when fees were paid. Correspondence was typed, mailed, or faxed. And the first digital archive used Microsoft Documents and an IBM 5150. EAACI was stepping into the digital age. In 1989, EAACI held its 14th Congress in Berlin West from 17th to 22nd September. Only weeks later, on 9th November 1989, the Berlin Wall fell. A historic moment that reshaped both Europe and EAACI.
In September 1989, the European Academy held its annual meeting in Berlin. At that time, actually, it was West Berlin. Nobody expected at that time that 50 days later, the Berlin Wall would come down. Really an event which was not only important for Berliners or Germans, but also changed the situation all over Europe. All of a sudden, not only we could visit each other from west to east and east to west, we could have conferences, workshops together, which was completely new, and we could even collaborate with each other. This was a major step forward, I think, also for the development of our academy, which then had a chance to grow in all Eastern European countries.
EAACI expanded its scientific reach with its journals. Allergy, Pediatric Allergy and Immunology, Clinical and Translational Allergy. These publications reinforce the Academy's global scientific leadership.
We are also proud to publish 3 leading journals. Allergy, the highest ranked in our field, features cutting-edge research and clinical advances. Pediatric Allergy and Immunology focuses on diseases in children, while Clinical and Translational Allergy, our open access journal, which promotes interdisciplinary research and rapid dissemination of innovations in clinical science and translational immunology. Together, these journals strengthen EAACI's role as a leader in science and education.
For many years, EAACI rotated between triannual congresses and annual National Society meetings. Each model carried benefits and challenges, from local flavour to logistical complexity. A major transition followed. Annual congresses organised centrally.
In the early years, EAACI congresses were held every 3 years, with smaller meetings in between, organized by national societies. This model later evolved into annual congresses managed centrally by EAACI. This change brought standardization, ensuring that congresses were no longer dependent on national organizations, but had a consistent quality and identity. At the same time, we established agreements with our founder sponsors. These partnerships expanded EAACI's resources and outreach, allowing us to increase participation, launch new educational activities, and create a platform for communication and collaboration. While these new agreements expanded our resources and opportunities, EAACI always maintains its full independence. The scientific program has remained under the sole responsibility of the Scientific Program Committee without any influence, and CME accreditation continues to safeguard the integrity of our content.
By the 1990s, the Academy needed new generations. The junior member policy was created to open EAACI to young professionals.
1998, the category of junior members is established. In 1998, our academy was primarily composed of older members, with an average of 56 years. Only 7% of our members were below 35. Recognizing that the vitality and the future of any society should rely on junior people, the Executive Committee launched a fundraising campaign in order to support the free subscription of junior members and their free participation to allergy congresses and schools. This initiative proved highly successful, as reflected in the makeup of our current membership. Notably, 50% of our approximately 20,000 members are below 35 years now. This is the best guarantee for a bright future for our academy. And EAACI should be proud of pioneering an initiative that has been since adopted by many other scientific societies.
The Academy expanded its structure, identity, and activities during the early 2000s.
As our academy expanded, new structures were created to engage a growing membership. The merger with the European Society for Pediatric Allergy and Clinical Immunology, ESPACI, in 2001 strengthened EAACI sections, while interest groups provided dedicated forums for members with specific expertise and interests. During this period, the European Academy also developed its logo and corporate image, a unifying identity that still represents us today. Focused meetings were introduced, including PALM and ISAF, reducing the burden on local organizers and broadening the scope of our scientific exchange. Summer and winter schools were further coordinated in a more efficient way, supported by the establishment of a professional headquarters in Zurich. And in 2005, the European Academy Awards were launched, honoring excellence and inspiring future leaders in our field.
As EAACI grew, so did its need for a professional home.
As EAACI expanded, it became clear we needed stronger centralized support for new initiatives, member services, and international collaborations. At that time, our organization was run by barely 2 people. With the introduction of a new vice president structure, each with clear responsibilities, an independent and larger headquarters became essential. Managing our own business allowed us to better support the growing executive committee and membership. We also learned that being embedded in a Congress organization was not sustainable. This challenge highlighted the importance of achieving financial independence. From there, EAACI entered the phase of real growth with rapidly increasing membership and the launch of new projects, such as the EAACI UMS Knowledge Exam, now a benchmark of excellence in our field.
In 2007, after years of discussion, EAACI began a process of establishing its own headquarters, and several countries were carefully evaluated, both from a legal as well as a political and practical perspective. In the end, Switzerland was chosen because it was most suitable for multiple reasons, and there were really professional people available in that country to help us grow. With the support of an executive search firm, a managing director was appointed in 2008, and a small soon was recruited in the office established in central Zurich. Over time, the team grew, and while event management was initially outsourced to a company in Sweden, it is now internally run by a much larger and highly professional office. This journey shows that even the strongest institutions benefit from starting small in order to grow organically and sustainably and being strong as it is today.
Outreach became the driving force of EAACI's next era. Advocacy, global partnerships, and a broadened mission.
In 2010, approximately, EAACI felt very comfortable. It had its own headquarters. The finances were really good. So we thought that we could deliver better our vision if we expanded and if we approached more people. So first of all, we had to make a change in the constitution, allowing more people, both geographically from all around the world, but also scientifically from different types of societies, to come in as members. At the same time, we approached different allergy societies around the world, and we developed together some documents that were describing practical aspects of dealing with allergy, clinical allergy, the practical documents, and also international consensus documents, the ICONs, which describe differences between practice around the world and how you can actually reach a common conclusion and a common practice. We also did quite a lot of successful lobbying. We approached the World Health Organization, WHO, that was at the time making ICD-11, the International Classification of Diseases, the version 11. And we have successfully managed to include a chapter which was exactly for allergies within this classification. It's still there. And also we have approached the European Parliament and members of the European Parliament and organized an interest group of members of the European Parliament. Finally, we were very close to the European Medicines Agency, EMA, and other organizations, trying to explain to them how important is allergy and dealing with allergy patients.
But outreach is not only about advocacy and partnerships. It is also about leadership in knowledge. Clinical guidelines are more than documents. They are roadmaps. They transform scientific evidence into practical recommendations, helping physicians deliver consistent, high-quality care. Developed through rigorous review and expert collaboration, guidelines bridge research and everyday clinical practice. For EAACI, that became a cornerstone of its mission, advancing excellence in allergy and clinical immunology and supporting clinicians worldwide with trusted evidence-based guidance.
EAACI guidelines provide evidence-based multidisciplinary recommendations to improve and standardize clinical practice in allergy and immunology worldwide. They address a broad range of topics, including food allergies, allergen-specific immunotherapy, biologicals, and environmental science related to allergy and asthma.
EAACI has achieved unprecedented gender equality in its leadership structure. 14 of 23 executive committee members are women. 4 of 7 section chairs are women. All 5 interest group chairs are women. Today's EAACI reflects a balanced, inclusive and representative scientific community.
When I first became involved in EAACI, leadership roles for women were still far from balance. In fact, since the foundation of the Academy, there had only been 2 women president before me. And over the last decades, we have seen a remarkable and steady increase in the number of women across all levels of the Academy. Today, women represent a very significant part of our community. And I think this reflects not only the growth in number, but a real cultural shift. So women are increasingly visible as clinicians, as researchers, educators, leaders, and it is shaping the direction of our field.
For my generation, this change is very tangible. When young members join EAACI today, they see women everywhere, leading sections, interest groups, committees, and the Academy itself. That visibility sends a powerful message. Leadership is achievable, and it starts early. The junior members' activities play a crucial role in this. Through education, networking, mentorship, and the leadership opportunities, we actively encourage young women to engage, stay, and grow within EAACI. Increasing the number of women is not only about access, it's about support, confidence, and long-term inclusion.
And to be honest, what makes me especially proud is that this progress is built on merit and it's also built in opportunity. So gender balance at EAACI is not at all symbolic. I think it is the result of talent being recognized. So as leaders, we have a responsibility. We have the responsibility to keep opening doors and to support, of course, the next generation.
EAACI gives junior members a voice and a path forward. By empowering young women early in their careers, we ensure that the future leadership of the Academy is diverse, representative, and strong.
So the story of women in EAACI is one of progress and continuity, where experience and new perspectives come together to build a more inclusive future. So I think that the future is yours.
Maria, thank you for showing that women can successfully balance family and career and thrive at the highest level in both.
Every era brings its own challenges. For EAACI, the COVID-19 pandemic became one of the greatest trials in our history. Overnight, the world shut down. Travel stopped, hospitals overflowed, and uncertainty touched every corner of our lives. At that moment, EAACI had to answer a crucial question. How could we remain united as a scientific family when we could no longer meet in person? How could we continue to deliver knowledge, education, and connection at a time when our community was needed more than ever? The story of how we faced the crisis is not just one of survival, but of resilience, creativity, and a renewed sense of belonging.
When the pandemic began, EAACI was preparing for its Congress in London. Suddenly, everything changed. Event venues were turning into hospitals. Travel was impossible, and our community was on the front line of this unprecedented crisis. Yet instead of cancelling the annual Congress, we chose to adapt. Within weeks, the executive committee took a decisive action. Education had to continue, but in the safest possible way. We transformed adversity into opportunity by moving our meetings online. In just 3 months, we were able to host high-quality virtual events, ensuring that our members could keep learning and engaging despite the uncertainty. This was only possible thanks to the extraordinary resilience of our community, many of whom were delivering sessions while simultaneously caring for patients in overwhelmed hospitals.
As restrictions began to ease, EAACI faced another challenge: how to bring back the spirit of in-person congresses while preserving the benefits of digital innovation. Our first Congress after the pandemic in Krakow in 2021 was a moment of excitement and hope, proof of the resilience of the EAACI family. From then on, hybrid meetings became an important bridge, ensuring access and continuity. Yet we soon realized that on-site meetings were irreplaceable. The sense of belonging, of sharing science face-to-face, could not be substituted. So step by step, EAACI guided the community back to normality with events like Hamburg 2023, showing how strongly we wanted to be together again.
What I will always remember from this period is the incredible dedication of our members. While they were fighting for COVID-19 in hospitals, they also contributed to EAACI's educational content, keeping our mission alive. Their resilience and generosity carried us through. EAACI not only survived this unprecedented crisis, but learned from it, adopting new event formats, new digital platforms, and a stronger sense of togetherness.
Today, EAACI stands as a stronger, more connected community. We know that hybrid learning and digital outreach have their place, but we also know that the human connection, the joy of meeting in person, is at the heart of our academy. The pandemic tested us, but it also reminded us of our strength, adaptability, unity, and a shared commitment to advancing knowledge for the benefit of patients everywhere.
Today, EAACI stands strong, with a solid structure, a respected reputation, and a proven capacity to adapt in the face of challenges. We are proud of what has been achieved, but we also recognize that new horizons lie ahead. Our academy is not only a reference in Europe, but an essential voice in global science and healthcare.
EAACI is expanding worldwide with growing membership from India, more than 670, United States, over 540, Brazil, around 480, Mexico, above 380, China, approximately 340, Canada, close to 310, Republic of Korea, in excess of 280, Australia, nearly 270, Japan, around 200, Kazakhstan, over 140. This transformation marks the evolution from a European academy into a truly global society.
The new EAACI, one that has achieved gender equality in leadership, now faces a changing landscape. International partnerships are evolving, and education and research are under pressure for funding cuts. Yet we see this not as a threat, but as a call to expand our vision. EAACI is planning to extend its border beyond Europe, embracing its role as a truly global society. Our mission is clear: to ensure that education, research, and innovation in allergy and clinical immunology are accessible to colleagues worldwide. A defining milestone of this new chapter is the inclusion of the patient's voice at the very heart of our governance. With patients now taking part as full members of our executive committee, EAACI reaffirms its commitment to a collaborative and inclusive future. Together, professionals, scientists, and patients, we are shaping EAACI as a global society, ready to face the challenges of tomorrow and to continue making a difference for those who need us most.
From its origins in post-war Europe to its role as a global scientific leader today, EAACI's story is one of unity, resilience and vision. Scientific and technological progress in a changing global environment show that EAACI must evolve and adapt its areas of interest, organisation and structure. Together, scientists, clinicians, patients and partners, we continue shaping the future of allergy and clinical immunology for generations to come.